You. Once again, welcome to the teaching session of Department of Urology, Savai Man Singh Medical College, Jaipur. So, we will have a teaching session on lasers in urology, and we know lasers are omnipresent part of now the modern technology and the procedural medicine in urology. We will have a brief presentation by Dr. Anantbir Singh on lasers in urology, which will be moderated by our faculty, Dr. Dharmendra Jangid. So, Dr. Dharmendra Jangid, please go ahead and invite the presenter. Okay, go ahead. Go ahead.
Anantbir to start his presentation. Sir, is my screen visible?
Yes, yes.
Am I audible, sir?
You are audible, and don't and ask others to just keep as much silence as possible.
Yes, sir. Am I audible?
Go ahead.
Good morning, my respected teachers, dear colleagues and juniors. Today, I will be presenting a seminar on lasers in endourology. My moderator is Dr. Dharmendra, sir. Starting with the introduction, as we all know, laser is light amplification by stimulated emission of radiation. This acronym was coined by Gordon Gould. Albert Einstein proposed the concept of stimulated emission of radiation in 1917. And in 1960, the theory was put to use by T.H. Mammon to produce the first visible light laser, that was the ruby laser. Parsons expedited its use in canine bladder in 1966. Carbon dioxide laser was used in 1980, and photodynamic therapy was also expedited by Parsons. Mulvaney had directed the use of urolithiasis. This is the outline of what I have narrated now. In 1968, the first patient by Mulvaney and Beck, and creation of acronym laser was done by Gould in 1957. Now, coming to the properties of laser, three characteristic properties of lasers are coherence, collimation, and monochromaticity. That we have the comparative analysis between the laser and the ordinary light in the diagram. Coherence means all the waves of the light move together temporally and spatially. Collimation means they all travel parallel to each other with no divergence in its path. Monochromaticity means they all have the same wavelength or the color. Coming to the classification of lasers in endourology, there are three types of lasers that are used. Lasers for stone management, lasers for BPH management, laser for stone and BPH management. Holmium yak low watt laser is used for stone management. Laser for BPH management, laser, green laser, diode laser, laser management, holmium yak high watt laser, and thulium laser fiber. Classification as per pulsed or continuous. Continuous laser is thulium laser, green light laser, diode laser, KTP or ND-YAG laser, thulium fiber laser. Pulsed laser is holmium YAG or thulium laser fiber. Now, in these two classifications, we see what is common. Thulium fiber laser can be operated in both the continuous or the pulsed mode. Now, coming to the solid state of fiber-based laser, holmium YAG laser, thulium YAG laser, green light laser, diode, KTP and ND-YAG laser come under the category of solid state lasers, whereas a fiber-based laser come under the category of thulium laser fiber. Now, coming to the most important laser that is commonly used in urological practice, holmium laser, with important properties as highlighted. It has a wavelength of 2100 nanometer, completely absorbed by water within 0.4 mm of its fiber tip. It has a thermomechanical mechanism of action. It is a contact laser and fragments all the types of urinary calculi. It can be transmitted via fibers as small as 200 micrometer. Second is this is the design of laser beam production in holmium YAG laser cavity. Like we all know that holmium YAG is a solid state laser. From diagram A to F, it shows the mechanism of generation of laser beam. In diagram A, we see holmium ions are embedded in the YAG crystal, and they are excited by the light source towards the end. The light source comprises of xenon or krypton. This light source excites the holmium ions to a higher state that is shown in the B. So they emit the photon in the higher energy state. Coming from diagram C, D, E, and F, we see this cycle is repeated again and again to produce light amplification by stimulated emission of radiation. So F diagram shows the production of the laser beam towards the end, that is towards the operative site after the laser pumping. The two cavities of holmium YAG laser are the low power generators and the high power generators. Now the difference between low power generator and high power generator is that low power generator has a single cavity and it is up to 30 watts, whereas high power generator has multiple cavities and it is up to 120 watt. High power generators have vapor compression refrigeration system as a cooling mechanism. Coming to the KTP laser or the green light laser, KTP laser is derived from ND-YAG laser. It has a wavelength of 532 nanometer and penetration depth is 0.8 millimeter. Energy is selectively absorbed by hemoglobin but not by water. It has a very good coagulation effect which results in good control of hemostasis. It has a non-contact use called the photoselective vaporization of the tissue. Coming to the thulium YAG laser, it is a continuous wave laser with a wavelength of 2013 nanometer. It has a high absorption in water and low in oxyhemoglobin. It has an optical penetration of 0.4 millimeter and coagulation depth is less than 1 millimeter. High absorption of laser energy into the prostate and the tissue vaporization is there. Now commonly confused is thulium YAG laser and thulium fiber laser. Both are two different things. Thulium YAG laser is a solid state laser, whereas a thulium fiber laser is a fiber based laser. It is a valuable alternative to holmium laser. It is a long fiber stored with the thulium ions. It has a wavelength of 1940 nanometer and it is operated in both continuous mode or adopt pulse mode that I have already discussed. This is the thulium fiber laser cavity. The operating system, it is excited with the help of the diode lasers. Like we all see, it is a thulium doped silica fiber of 10 to 20 micrometer diameter and 30 meter length. Laser pumping is achieved electronically by diode laser that are shown in the pink boxes. The uniform laser allows use of fibers as small as 50 micrometer. Thulium fiber core has a diameter of 10 to 2 micrometer and length is 10 to 30 meters. It has electronic pulse shaped modulation. The most important thing is that it does not use flash lamp. Therefore, heat generation does not occur out of proportion. Water-based cooling system is not required. Like in holmium laser, there is heat generation and water-based cooling system is required, but this laser requires forced fan ventilation as a cooling mechanism, hence making it more portable. This is a comparison between the high watt holmium laser and the thulium laser fiber. In terms of wavelength, holmium is 2100 thulium 1940. In case of pulse energy range, we can see that thulium laser has low energy as 0.025 and pulse duration as high as 12 milliseconds. The pulse frequency of thulium laser can be up to 2000 Hz. That is done to compensate the low energy, so as the effective ablation of the stone remains the same. The smallest fiber available for thulium laser is 150 micrometer and for the holmium laser is 200 micrometer. Now the smaller fiber size of thulium laser fiber makes it more portable in the flexible ureteroscope so as to allow the stones that are present in the inaccessible location to be treated with intracorporeal lithotripsy, like in the lower pole calyx of the kidney. Cooling system, like we have discussed, it's a fan-based ventilation in thulium laser fiber, and durability against shock for holmium watt laser is low and durability against shock for thulium laser fiber is high. This is because the thulium laser fiber does not have reflecting mirrors as a mechanism, whereas high watt holmium laser have reflecting mirrors as a mechanism of laser beam production. Coming to the diode laser, laser light is produced using light emitting diodes, wavelength of 808 to 9 meters. It's absorbed in water and behaves similarly to ND-YAG laser. It's used for tissue coagulation and thermal treatment of solid organs, including the prostate. They are more efficient and potentially cheaper than most other lasers now in. Coming to the component of the laser fibers, the laser fiber is made up of these components. First of all is a fiber core that uses a laser beam mechanism of total internal reflection. This total internal reflection is made possible with the help of fiber cladding that is outside of the fiber core. This is made up of silica and it decreases the refraction of the laser waves that are traveling through the fiber core. This system is again reinforced by fiber jacket that is made up of ETFE, and this ensures frictionless movement between the scope and the operating medium. Coming to the laser fiber core from 1 micron, larger 5,000 micron are instruments in cases of holmium laser reclamation. Smaller ones are 240 to 270 micrometer sizes for flexible ureters that we use in IRF, and less than 240 micrometer size are more for years. Fiber flexibility 240 to 270 micrometer fiber core to deflection and for maximal deflection. Into flexible selected position, which is not as advisable for the flat fibers. It is for the phenomenon is a fiber burn back from the article back the role of during high power lithotripsy published in December 2021. According and to raise the fiber. And resection, example PPI transition carcinoma. We use ND-YAG, holmium YAG, KTP YAG, or semiconductor diode. For intracorporeal laser lithotripsy, we use holmium YAG, thulium, or frequency doubled ND-YAG laser. Urolithiasis, intracorporeal laser lithotripsy is used in the treatment of urinary calculi with retrograde ureteroscopy in the form of RIRS or PCNL. Laser lithotripsy was first used clinically in the late 1980s using the coumarin-based pulsed dye laser. Flexible quartz fibers deliver laser energy using flexible endoscopes. The mechanism of action is a plasma formation between the fiber tip and the calculus. It develops an acoustic wave and disrupts the stone along the fracture line. Holmium laser fiber is available in 200, 365, 550 and 1000 micrometer diameter in end or side firing fiber configurations. Lithotripsy depends upon the pulse energy diameter of the optical fiber. Pulse energy of 0.6 to 1.2 joules and pulse rate of 5 to 15 hertz can be used. Most commonly, the treatment is started at low pulse energy of 0.6 joules with a pulse rate of 6 hertz.
The fibers and they are still available in 1000 micrometers. What is your source? Is it a 1000 microns? Can be able to do or practice control? They have long been withdrawn. Because now everything can be done with the volume laser fiber of 365, 550 is enough. Now there is no company which is manufacturing 1000 micron fiber. Even for the prostate stimulation of the prostate, the 550 fiber is enough. And now with the working channels gradually decreasing in size, even these 1000 micron fibers, they are difficult to pass into a few channels. So you cannot just cut paste something which is going around since the last 20 years. Right? Did you look into any place latest that the 1000 micron fibers are available? Dekha aapne padha?
Sir, I read this.
Even cut paste contemporary some kind of a required, some kind of a gray matter is required. If मैं कुछ cut paste कर रहा हूँ तो बनते ही नहीं यार 1000 microns के fibers बहुत कम है, खरीद ही नहीं सकते.
Can we just go ahead with the presentation first, Hannah? Then we can discuss it. Please.
The hardest stones can be fragmented into small pieces. The energy available for fragmentation is limited by fiber diameter. The 200 micron fiber allows for the most endoscopic deflection, but delivers a lesser amount of energy to fragment the stones. Other advantages include minimal fragment migration and retrograde retropulsion when low settings are used, and its ability to deliver higher energy settings even through the smallest delivery of fibers. Now, three mechanisms by which the stone is fragmented, dusted, or popcorn are shown. Now, dusting is done at high frequency, low energy, and at longer pulse duration. Fragmentation at high energy, low frequency, short pulse. Whereas popcorning requires both high energy as well as high frequency. These are the diagrammatic depictions of the mechanism of laser fragmentation of the stones. Painting is best for the softer stones. How? Place the fiber in contact with the stones, brush back and forth the stone, ablating it layer by layer. Chipping is done, it's best for the harder stones. Fiber is placed in contact with the edge of the stone and held steady as small chips fragment off. Popcorning is best for the group of 3 to 4 millimeter fragments in a non-dilated calyx. How? Place fiber near stone but not in contact with the urothelium. Deliver intermittent laser bursts causing movement of stones and fine fragmentation. Fragmenting is best for the single stones. How? Place the fiber in contact with stone and pin against the urothelium. Focus the fiber on one point until the stone breaks. Now coming to another important topic, Moses platform for holmium laser lithotripsy. The Moses technology energy is delivered over two pulses called pulse modulation. First pulse delivers energy to form the vapor bubble as we see in the diagram towards the right. Second pulse delivers the rest of the energy through the already formed vapor channel. So the less energy is lost and the laser transmission is less dependent on the fiber stone distance. Hence it minimizes the stone retropulsion. This is a video description of Moses technology that was started by the Luminis. So optimized energy transmission. Now comparison with the regular and the Moses. This shows the vapor bubble and through that vapor bubble. There is stone migration. Comparison of regular and Moses again. Regular is more propulsion, whereas for the Moses, the retropulsion is less and the stone fragmentation is efficient. And control is more in case of Moses, where less retropulsion is there, as seen on comparative analysis on right and left. The left one is regular for regular laser and the right is for the Moses technology. Now coming to the topic benign prostatic hyperplasia, the ND semiconductor diode, holmium yak, thulium fiber laser have all been used to treat BPH. The energy effect is determined by wavelength of the laser light, power density and duration of the treatment. The laser prostate tissue interaction includes coagulation and vaporization. In coagulation, the tissue temperature is greater than 100 degrees Celsius, whereas in the vaporization, the temperature is up to 300 degrees Celsius. The four principal techniques in BPH that were used: transfer laser-induced prostatectomy, visual laser ablation of prostate, interstitial laser coagulation, laser resection, and enucleation. In holmium laser, we commonly use holmium laser enucleation of the prostate. The others are holmium laser ablation and holmium laser resection of the prostate. Now coming to HOLEP. HOLEP is the tissue vaporization with a contact bare tip laser fiber. If the gland is greater than 60 grams, the enucleation is better. The prostate lobes are enucleated into the bladder and later on they are modulated and delivered. The HOLEP is offered as a size-independent gold standard for patients with lower urinary tract symptoms because of BPH. This is an orange model compared to the HOLEP. Imagine an orange. A HOLEP would be similar to removing the inside of orange but leaving behind the peeling. The option that is typically used for larger prostates. A laser is used to enucleate or pour out the prostate in one piece. A separate instrument is then used to cut the prostate into smaller fragments. This is a video of basic polyp, which shows a laser fiber that is coring out the enlarged lobes of the prostate. After the enucleation through and through, the lobes are delivered back into the bladder and with the help of the moderator taken out. The complications are injury related to urethral orifice during capital position is 10%, that is managed with long catheterization. Urinary incontinence is transient 10% and permanent is 0.7%. Bladder contract is to 3.2%. Urethral 7% and retrograde ejaculation is 78%. Advantages and disadvantages are it has a for this tissue histological examination. Coming to another important use of lasers, urothelial malignancies uses two main laser tissue interactions, photothermal and photodynamic. Photothermal effects are coagulative necrosis of the exophytic superficial bladder tumors up to 2.5 centimeter in size. Anti-ag laser has the best properties for use in bladder cancer, but limiting the energy to 35 watts, temperature more than 60 degrees Celsius. Laser therapy is more expensive than resection due to the cost of laser fibers with advantage of negligible bleeding. More recently, thulium laser has been used for en-bloc resection of the bladder tumor. Who are the optimal candidates? They are recurrent, low-grade lesions with histopathology that is already known. Holmium YAG, argon and KTP lasers ablate the tissue by cutting and thus have the limited applicability due to the lack of deep coagulation. The most significant complication of laser therapy is the forward scatter of laser energy to adjacent structures, resulting in the perforation of hollow viscous organs such as overlying bowel. This is rare but most commonly occurs with ND-YAG laser. Coming for the renal tumors, retrograde or percutaneously, we can use lasers. Indication is small tumors in the patient having a solitary kidney or bilateral tumors or the renal failure, or those patients who are unfit for major surgery. Advantages over electrosurgical treatment include absence of bleeding, lower incidence of stricture formation because there is a minimal fibrotic reaction. Disadvantages include inability to accurately predict the depth of coagulation and possibility of incomplete tumor eradication. Coming to photodynamic therapy, tumor ablation in which a systemically administered compound is absorbed or retained by cancer cells and converted by laser light to a toxic compound. Lasers are ideally suited for this form of therapy because of their monochromaticity and maneuverable delivery systems. As a photosensitizer, we use photofrin 2, a derivative of hematoporphyrin. This is the dose of photofrin 2 that was used 1.52 milligram per kg, followed by a few days later by a single exposure of whole bladder to the laser light. The candidates for photodynamic therapy are patients with superficial TCC, stage TA, T1 or carcinoma in situ. This is the diagram of laser showing the ablation of the tumors. Now coming to another important use in the urethral strictures. Urethral strictures may be post-traumatic or idiopathic. The lasers used for internal urethrotomy include KTP, argon, diode, ND-YAG and holmium YAG laser. The core through urethrotomy involves coring a channel through the block site towards the light of endoscope introduced via a suprapubic tract and through the bladder neck to the proximal end of the occluded urethra. Holmium YAG laser core through urethrotomy is alternative to urethroplasty. It's used for patients with failed urethroplasty. Core through urethrotomy is more if there have been no previous manipulation, distraction, injuries, or associated false tract. Coming to laser bladder neck incisions, bladder neck contractures developing following prostatectomy have been treated using laser energy. Holmium YAG is the best form of laser energy for these cases because of its safety, precision, and minimal collateral injury. PUV fulguration. PUV is one of the most common cause of infravesical obstruction in the male infants. Therapeutic modalities for PUV include electrocautery, fulguration, or resection or diversion. Fulguration can be done with a holmium YAG laser with a low incidence of stricture formation. The construct in use do not directly change to the body with optical instruments. Ending the seminar with a quote: "Focus like a laser, not a flashlight." From Michael. Thank you.
मैंने कोड थ्रू जो है ना बोला था ना कि कोड थ्रू में we can use for failed urethroplasty, कोड थ्रू can be done with the laser. So जब ऐसे ना then you should bring the studies also, right? कि what studies were done and whether there was any randomized trial. It's because even if you don't use the laser, then people would not advocate doing a code through even for a failed urethroplasty at all. So what is the success rate of core urethroplasty, especially using laser? It's more imperative that slide here. Secondly, you mentioned all the chipping and all, and the painting and the chipping and the one thing you did not mention in hard stones, the drilling, which is also known as the mining, in which you contact more, you drill multiple holes inside readily from the stone, and then ultimately the stone and all of a sudden the stone fragments into multiple. So this is also one modality in which the stone can be, the laser can be used for the stone. But yeah, I don't think that inside you should write for this go through the laser.
Yes, I think it's correct in the sense that CPA for 3 years or is more of a kind of just an experiment, yes, and it's not an established approach for urethroplasty or for so we should not mention it. Just get mentioned that yes, studies have been done. Anybody else? Any queries?
Thulium laser का नहीं था. So thulium comparison of thulium, and if you would have compared, मतलब बताया, लेकिन you should always compare, because the $1 million question now is thulium versus the holmium.
Yes, sir.
So if you and okay, yeah, then I missed it.
Sir, because moderator issue all the tools available, but as compared to TURP, the yes, 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 yes.
For the treatment of uretic stones or other things, what is the biggest disadvantage?
Sir, thulium YAG laser is a solid state laser, and it can be operated only in a continuous mode, whereas thulium fiber laser, it can be operated in both continuous and the pulse mode. So it also has a fan shaped ventilation system, so it makes it more portable as compared to the thulium.
Understand this question. What is the biggest disadvantage of thulium? And he probably meant by thulium fiber. Thulium YAG is usually not used for lithotripsy. And secondly, the thulium YAG is now come as pulse mode also. So pulse thulium YAG laser is also. So what is the biggest disadvantage if you compare volume with thulium fiber laser for lithotripsy? These are all advantages you have. Right? So what else?
Sir, fiber is small and pulse range of 0.025 joules. Right. It will fragment the stone less effectively, sir. And so to compensate that, the pulse frequency is up to 2000 hertz.
Right.
That will make the ablation volume more or less the same, sir.
Right. What else?
Thermal dissipation किसमें ज़्यादा होता है? See, when you ask the question, what is the complication that we are facing now with thulium?
Thulium, yes.
तो आपने fan बोल दिया और छोटा है, मोटा है, ये frequency.
Sorry.
So आपने मुझे बताइए
major issue we had was an increased thermal energy.
Yes.
Or causing more of
Ureteric injuries.
damage to the urethral mucosa when the medication. So that is why it's very important that you keep the total power.
Yes.
In kidney, it has to be kept below 25. The total power, which is frequency into watts, joules, right? So, and in ureter, it has to be kept below 12. So, in fact, though the frequency can be raised to 2000, but it is not much of use. Probably even in RIRS, because they keep the frequency low, maybe at 10, 15, right? Anything else? I would expect queries and comments and things from residents.
Yeah, आपने इतने सारे lasers बताए जैसे you told about the KTP also, the diode and this in a NDR laser volume. So what do you think is the one-stop solution to all the problems? You wanted to use it in urolithiasis also, prostate, you also like to use it in a few other indications you said on soft tissues, like OCA bladder or for stricture. If you want to purchase one laser, then which is the laser you think should be giving you a solution to all this?
Holmium laser is considered
Nowadays, see, so many now we have talks, we have talked to it, probably ahead of Holmium jab. But now the Holmium jab again, we have another Holmium jab. What is that?
Moses technology.
Moses technology. Yes. The retropulsion is very less, but still they say it is not as less as in thulium fiber. The retropulsion will be least with thulium fiber. The Moses has lesser than the normal Holmium jab. So this is a kind of a pulse wave. So again, Holmium jab long pulse wave, short pulse wave, you have to reduce. Again, there is something called peak power. What is that? So I think all these things are very important when you compare helium and Holmium. Peak power would be very high. It is around 10,000 watts in Holmium. And with long pulse, it is 2,000 watts. Whereas in thulium, it goes down to over 500. That is very important. This is what kind of energy delivery. Another thing, thulium fiber has to be always put on contact. Contact, तभी it will work. Whereas Holmium, you have to be away from the stone. Like this is a non-contact.
What is the disadvantages of the laser in which in CA bladder in which you cannot treat a case of CA bladder?
Sir, NDAG laser, sir, is there can be the depth of
In which
penetration.
clinical situation of a CA bladder laser cannot treat the patient of CA bladder?
Sir, if the growth is greater than 2.5 centimeter in size.
Have you mentioned about the
Solid.
direction? Did you mention about that? Did you mention?
Yes.
Okay, fine. So which kind of resection?
Sir, the tumors that are small and they have
कौन से tumors are there? Smallest tumor कौन सा होता है bladder? Flattened lesion which is very small and sometimes difficult to
carcinoma in situ.
CIS को करना is very difficult. By bladder जैसे आप socialization करना चाहोगे या फिर
The only indication for it is not for bladder tumors as such. You cannot resect the bladder tumor laser. Only thing is you can do an end block resection. So that is coming up very fast. So you can do end block resection with laser. You cannot resect tumor with laser. Only you can do a little bit of pulverization if you want just pulverate the area. That can be the case. So end block resection is coming up very well with both him and if I ended up going.
दूसरे अब तो बड़े tumors का भी end block resection they are doing 2 centimeters के tumor.
हम करते हैं तो अपन भी करते हैं. So we are doing till 4 centimeter. More than 4 centimeter you cannot remove it end block. That's the main disadvantage of end block is larger tumor you cannot remove the tumor as such. You have to cut the tumor and send it. That's the disadvantage. Otherwise, you can do even large activities.
Michael Jordan pump.
Basketball.
Which team did Michael Jordan win his 5 NBA titles? Which team did Michael Jordan win his 5 NBA titles? Chicago Bulls. Which NBA team does he want to present? Washington Wizards.
Right.
जाने से नहीं होता है।
Anybody else? Any question? अगली बार यदि आप क्वेश्चन नहीं पूछोगे तो फिर बाद में
You said yes, sir, no question.
no point in coming. और secondly, I would ask कि आपका जो Zoom पे जो Monday वाला है, there is no point in doing it here. आप जो वाला क्लास तैयार करो लाइब्रेरी वाला, and we will do it there, the Zoom class. Yeah, so this is the sound is horrible, right? When you hear the online, it's not all up to the mark. So we will do the Zoom class there, and the rest two physical classes can be done here, right?
Thank you, sir.
सेमिनार में तो आ जाएंगे सर, अपने लोग तो आ जाएंगे सेमिनार में।
Thank you.